Thank you for choosing to partner with Prestige Wellness Institute for your health journey. The purpose of this video is to prepare you for your first visit and to give you an understanding of what it's like to work with us. While we prepare for your first visit by gathering and reviewing the information you provide us, this video will help you understand how we operate and why we do the things we do. By us doing our part and you doing your part, we ensure that we are able to make the best use of our time together when you actually come in for your appointment. In fact, by taking the time to watch this video, you are already making an important investment in your health. Think of this as part one of your consultation appointment. People come to us for a variety of reasons. Some choose us because we have a particular machine or treatment protocol. Others have seen a handful of doctors and been unable to get the answers they're looking for. Some have had enough of assembly line medicine and are tired of feeling like just another number when they go to the doctor. Still others get tired of a friend or family member nagging them to come see us. Regardless of the reason you picked up the phone to make an appointment, we congratulate you for making the decision to make your health a priority. You might think our goal for you is just to help you achieve and maintain optimal health. This is partly true. Our real objective is to help you be free. Free to do those things you enjoy. Free to pursue your dreams. Free to fulfill your mission in life, whatever that may be. Optimal health is just a means, not a goal in itself. Nothing gives us more sadness than seeing young people in their 70s and 80s sitting in recliners staring at the wall in nursing homes. On the other hand, nothing brings us more joy than listening to our older patients recount their adventures around the world, going for hikes, writing books, gardening, or playing with their great-grandchildren. In order to enjoy the freedom I have described, each of us needs to invest in our health. This is a critical life choice. Invest in our health now or pay for disease later. Let me repeat that. Your success in your effort to achieve the freedom you want depends on your willingness to invest in your health today, so you don't have to pay for disease tomorrow. Of course, we have lots of tools to help you if you're already dealing with disease. But our goal is to help you create health in your life, not merely manage disease. This change in focus is a radical departure for many of our patients. Most doctors are trained to provide insurance medicine. In case you haven't noticed, let me describe what this means. You walk into your doctor's office, sit in the waiting room watching CNN for an hour and a half, then get taken back to the exam room. When the doctor comes in, you tell him what's bothering you. He asks a couple of questions, then he writes a prescription for a drug that he hopes will be approved by your insurance company, and then tells you to come back in a month if you're not feeling better. Insurance medicine is good for acute crises. Insurance companies value and therefore pay for sick care. By contrast, what you need is health care. Sadly, insurance companies regularly pay $300 to $600 a month for some drugs, but won't pay $20 for a hormone, vitamins, minerals, or herbs. I'm reminded of the saying, insurance is like a hospital gown. You think you're covered when you're not. Patients who are accustomed to insurance medicine will notice a number of differences when they first come to see us. Besides the fact that your visit will often be much longer than you're accustomed to, you will quickly discover that our focus is not merely to make your heartburn go away, treat your depression, or dull your pain for several hours at a time. Whatever symptoms are bothering you, we are looking at the bigger picture. We are asking ourselves, what deficiency, toxicity, injury, or other disturbance is causing this problem, and what changes need to take place in order to prevent additional problems down the road. Insurance medicine is focused on episodes of illness. First, you see your doctor and start the heartburn drug. A few years later, you need the blood pressure drug. Then it's the cholesterol drug, the depression drug, the diabetes drug, and then the heart failure drug. The older you get, the more drugs you take for all these chronic conditions. These drugs manage your diseases, but don't cure anything. In other words, as the years go by, you experience a steady decline in your overall health. By contrast, our approach is to see your heart attack, diabetes, cancer, Alzheimer's, or autoimmune disease from miles away and help you take the next off-ramp so you can turn around and go back the other way. Our easiest patients are the ones who have already been to the university or to the Mayo Clinic and not gotten answers to their problems. If you've been to one of these places already, this is really good news. It means you don't have a disease. Because if you had a disease, you better believe they would have found it. Instead, you have dysfunction. Something isn't working right. We can help you with lots of diseases, but it's a lot easier to treat dysfunction than it is to treat disease. The problem is that doctors aren't trained to treat dysfunction. This is why our average patient has already seen 5 other doctors trying to find solutions to his or her problems. We call this unwitting medical neglect. In other words, although they have brought their problems to medical attention, nobody has looked at the big picture to figure out what is going on under the hood, so to speak. Another distinguishing characteristic of our practice is that we don't prescribe a drug for every symptom you are experiencing. Rather, we identify and address underlying problems. Then we see which symptoms go away and which are left over. Any remaining symptoms trigger a search for and treatment of additional underlying causes. In other words, at Prestige Wellness Institute, we practice functional medicine, otherwise known as root cause resolution medicine. What does this mean in terms of how we work together? This means we send you a number of questionnaires and forms to get to know you before your first visit. Depending on circumstances, we may also order labs and request records from your other providers. As a result, we end up knowing more about your health than you do, even before meeting you. Then, during your first visit, we ask lots of questions to clarify or provide more detail on what you have already told us. Then we spend a significant amount of time explaining what is going on in your body and how to fix the problems. Even within the first 15 minutes, it is not uncommon for new patients to tell us that we have already spent more time with them than any doctor they've ever seen. Mind you, it's not because we can't find our prescription pad. It's because true healing doesn't occur in a typical 6-minute office visit. The human body is not like an automobile you can pull into the shop, drop off, and pick up 5 hours later, all repaired. Rather, you pull into the shop and tell us what funny noises you are hearing. We run the diagnostics, and then we bring you the tools and show you how to fix your car. It's not something we or anyone else can do for you. Well, we do have some tools that only we can use, but much of the healing process is a do-it-yourself job. We bring out the tools and walk you through how to use them. To further illustrate how we work together, let me use another analogy. Let's say you're taking a road trip. You're the driver and we are the navigator. You tell us where you want to go, presumably toward optimal health, and we tell you how to get there. If you want to go faster or slower, you adjust the gas pedal and put on the brake as appropriate. In other words, this is a partnership in which you are the boss and we are your advisors. Again, thank you for choosing Prestige Wellness Institute. We look forward to partnering with you. If you are like most of our patients, we expect you will look back 6 months from now and wish you had come 10, 20, or 50 years earlier. Welcome aboard.